Thank you so much for joining me.
Thank you so much for having me. I'm so excited to talk to you today.
So, before we get into the different options for various cosmetic concerns, I'd love to get your story. Can you tell me how you got to where you are today?
Well, I was originally born in Iran, and then of all places, I moved to Kentucky when I was 9, which was an interesting childhood. It was a great childhood, but a little bit of a culture shock for me. And then I slowly migrated out west. I went to the University of Kentucky Medical School, and then the Mayo Clinic, and then UC San Diego for dermatology, and I just fell in love with San Diego and the palm trees, and I just decided to stay. So I've been in San Diego now for, gosh, I want to say like 20 years. And I started out actually practicing in a large sort of medical corporation. And then after about 10 years, I decided, this is just not for me. I'm old school. I believe in that, traditional medical practice. So about 7 years ago, I started my own practice in La Jolla, California. And so I've been absolutely loving it since then. I started a bunch of other things 7 years ago, including my own podcast and a skincare line. And so, yeah, so I've been, having a good time since then, treating patients, educating patients.
So, tell me about your practice in La Jolla. Can you tell me about what you typically do? One of the things that you have been very well known for are your laser treatments. You're very open, you show a lot of them on social media. But tell us a bit about your practice, the type of patients you see, and the types of things that you treat.
So we are a full comprehensive practice. We do medical dermatology, but my practice is mainly focused on cosmetic dermatology. So I do a lot of lasers, a lot of injectables. I have a passion for lasers, which is a very expensive passion, but I really love, having these challenging cases and figuring things out. And I think the most rewarding thing that I do is really helping people regain confidence because it's really life changing to see these people come in on the first visit. And then, 6 months, 12 months, later, we just see this transformation, not in just their skin, but like their whole life changes. So for me, that's really my biggest motivation to, do the best I can and try to figure out some of these tough cases. So we do a lot of laser resurfacing. We treat a lot of sun damage because we're in Southern California. So, a lot of red spots, brown spots, obviously a lot of fine lines and wrinkles. And I also do a lot of acne scars, which is probably the most challenging thing I treat in my practice. Those are really difficult to treat, and also just scars. And then I also love treating the eyes, particularly dark circles. I use a treatment called eye glow, which is a white opaque filler, meaning you can't see through it, because typically fillers that are placed under the eyes are clear. And because the eyelid skin's so thin, it can transmit light and give this kind of blue hue. But with this filler, because it's opaque and you can't see through it and it's white, it has a nice brightening effect. So I do a lot of that in my practice also.
So, if you look at your practice, can you tell us how many light based or basically high tech treatments, devices, I guess, that you have in your office? Can you count them?
Yeah. I probably have now over 23 lasers and devices, which is, I'm telling you, it's a very expensive habit because all of these are like Lamborghinis and Ferraris, and they obviously require maintenance, but they're sort of my toys. So the first 10 years of my practice, I worked with a doctor named Vic Ross, who trained under Rox Anderson, who actually discovered lasers and the whole theory of photothermolysis. So I fell in love with the physics and the practice of lasers. And at that practice, I mean, we had probably over 45 different lasers where we would, help these companies develop settings and so forth for these laser devices. So that's, I guess, where my passion started. And I sort of treat dermatology with lasers. So if somebody has an actinic keratosis or a mole or a skin cancer, or, a lot of just cherry angiomas. So a lot of these, medical dermatology things, I use a laser for it. So, and I guess that's stems from my time with Dr. Vic Ross, who sort of inspired my passion for lasers.
So the reason why I brought you on the podcast today was just because of that. I've talked to my followers about how if all you have is a hammer, everything looks like a nail. And there are certain practices, you can see family docs who may buy like one laser and use it for everything. Plastic surgeons, they don't buy 20 lasers at one time, or they don't buy 20 lasers and have them all functioning in their office. We have a number in my practice, and so we do have a lot of versatility here, but we don't have 20 lasers. And so I thought today what would be really interesting for my listeners and my followers to learn about are various cosmetic issues that are very common and how you treat it using high-tech, basically, devices. And so I'd love to start today by probably starting off with the most common complaint that people have, and it's just fine lines and wrinkles. As we get older, we get fine lines and wrinkles. How then do you treat it in your practice when somebody comes in with that as a complaint?
Yeah, and that is something, probably one of the most common complaints in my practice also. So, it depends on the patient's skin type, obviously. It depends on how deep and severe those wrinkles are. It depends on their age. It depends on, their lifestyle. Because I see patients that are like, I can only do 1 or 3, days of downtime, no more than that. Other people are like, I only want to see you once. I want to do like, the big resurfacing. And so yeah, so I don't want to keep coming back. So my general answer to that would be laser resurfacing, but that's a pretty big, broad umbrella. And under that umbrella, the way I explain it to patients is, look, I can do a treatment that's like a chamomile tea version, for you, or you can come in and I can do a double shot of espresso here where, we're taking off the entire surface of the skin and allowing your skin to regrow back with smoother, tighter, better quality, healthier skin. The double shot of espresso is certainly going to be, a good 7 to 10 days where you might look like Freddy Krueger or, scare patients. Whereas the chamomile tea, maybe you have like a day where you're kind of red. You might develop a little black splotches, but you could wear makeup and, and be done with it. So, I really try to get to know my patients as a whole. And I love that you're very similar in that you're sort of this holistic approach to medicine. And so I always try to figure out what would be the right treatment for them specifically. Because I have a lot of patients that come in and they're like, well, I want a CO2 laser. And I said, oh my God, that would be the worst thing you can do. Do not do a CO2 laser. But the CO2 laser is an absolutely amazing treatment. And I do that all the time. But again, for the right patient. So if we're looking at something like the chamomile tea version or like a green tea version of a resurfacing, then something like a clear and brilliant laser or the Moxi, maybe a light Fraxel would be, kind of my approach, my go-to. If somebody has, let's say, darker skin tone, and has, mild to moderate wrinkles, then I would do like a fractionated erbium laser. Something like the profractional is great. And with these lasers, and I don't think a lot of people understand this, but we can control the downtime, the intensity, the recovery time just by adjusting the settings, just by determining how deep we're going to go and how dense we're going to go. Because the lasers are actually very, very precise. And the way the laser resurfacing works is it vaporizes, a fraction of the skin, and then your body, forms new skin and helps remodel that collagen. So I can do, a really heavy treatment or light treatment, and that's really up to the operator, not really the laser per se. But if you're looking for something like a black tea, let's say, a coffee kind of treatment, then I love the halo laser. It has 2 resurfacing lasers in the one device. It's actually a very sophisticated, very elegant device, and it has a non-ablative, mostly non-ablative. That means that the surface of the skin doesn't really get treated. It works pretty much underneath the skin. And the advantage of that is you recover faster, so there's not as much downtime. And so the halo is great for somebody with sun damage along with lines and wrinkles. Actually, it also treats precancerous lesions. And some recent studies have shown that this type of resurfacing can help with reducing your risk of developing skin cancer down the line. So that would be sort of my black tea, coffee version. And then we get into the double shot of espresso. For that, you're looking at about 3 to 5 days. So 3 to 5 days of downtime. But the nice thing with the halo is you don't have to look like a grease ball. You can just wear a lotion. It's because it's mostly what we call non-ablative. It doesn't take off the surface of the skin. So we don't have to, put that greasy balm on that can be difficult to wear makeup and, go out. But so that would be kind of the moderate, which would be 3 to 5 days. And then we're looking at sort of what I call a double shot of espresso, which is where we take off the entire surface of the skin. So not just fractions, but you're essentially having a big wound on your skin. And I tell patients, look, it's like, how alligators lose their tail and they grow a new one. This is very similar in that, we take off your skin and you grow new skin, and it's tighter, it's smoother, it's healthier. And it can last for, quite some time. But again, you're going to look like Freddy Krueger. You're going to scare small children for those 7 to 10 days of downtime for that, double shot of espresso. But the results are so dramatic. I mean, there's really nothing like that level of resurfacing that you get in the right patient. Again, if somebody's, darker skin, I would never do, that would definitely not be my top choice. And those lasers can be something like the CO2 laser that you hear about a lot now. It could be a full field erbium laser. And those are, very powerful. But again, the longer the recovery, the more intense the treatment, the greater the risks, but also the greater the potential results. So you have to keep that in mind.
So when you have a patient who says, hey, I want to do either the moderate treatment or the more aggressive, as a dermatologist, how do you control their discomfort? Because these can be pretty painful procedures to get done.
Yeah, absolutely. So, well, one of the reasons I, opened up my own practice is my patient comfort was like the patient experience was really my number one goal, coming from a corporate medicine sort of practice. So we do have, warm blankets. We have music for them that they listen to. We put on topical numbing cream for an hour, sometimes an hour and a half. If we're doing really intense treatments, then we're doing nerve blocks. We're doing local anesthesia. And we also have Pronox in our office. I don't know if you have that, but it's laughing gas. It's nitrous oxide gas. What I love about it is it's not like narcotics where it has a lingering effect because it's a gas. It leaves your body pretty quickly. So actually you can drive yourself home because it's so short acting. And so that helps because it sort of disassociates people from what's happening. But we really try to make them as comfortable as possible. And I also feel like a lot of times people have bad experiences during these procedures because you don't prepare them, for these treatments. Especially for the bigger treatments, I show them the scary pictures, they know exactly what's going to happen. And I think that when patients know what to expect, they go into a treatment with calmer nerves, just a better overall experience because you've told them the good, the bad, what to expect, and always sort of checking in on them and making sure, are you in pain? Is this okay? Because the worst thing you want is somebody, leaving a treatment and just having a really traumatizing experience. And that unfortunately does happen. So we try to do everything we can, not from just, anesthesia perspective, but just, warm blankets, neck wraps, all these things to try to make it as comfortable as possible.
So going back to the least aggressive of these treatments, you mentioned Clear and Brilliant and Moxi. What are the differences between those two treatments for people who are listening today and maybe they've seen some doctors and some of them have recommended Moxi, another one has recommended Clear and Brilliant?
Yes, Moxie is probably like a green tea, and the Clear and Brilliant is more like a chamomile tea. But they're both non-ablative, which what that means is you're really removing tissue without causing any sort of wound on the surface of the skin. So it's all working, under the skin level. So for that reason, you heal relatively quickly, and there's no oozing and open skin or anything like that. And the other aspect to it is it's fractionated. So you're not just taking off, removing the full surface of the skin. You're just taking a little fractions of it. So it tends to be not as deep and not as dense. So the recovery is really, really quick. So if you've got darker skin, maybe you're younger, you don't really need a heavy treatment. You just want a little bit of a refresher, a little bit of, new fresh skin coming up without having, a lot of downtime, then that is a great treatment, because then you're looking at, 1 to 3 days where it's a pretty quick recovery.
And where do chemical peels fit into this whole equation if you're looking at fine lines and wrinkles? Do you ever recommend peels, or do you usually stick with the lasers? And what are kind of like the pluses and minuses when you're looking at them?
Yeah, that's a great question. I think chemical peels are really wonderful, and they're certainly underutilized. Lasers are so fancy, there's technology, but chemical peels are actually can be really great for the skin, and lower cost certainly that to do than some of these really expensive laser treatments. And the chemical peels, the problem is for me is it's harder to control the depth of a chemical peel than it is like a laser beam, at least for me. And it's great for like pigmentation, really kind of fine lines, not super heavy, deep lines, unless you're doing a really deep chemical peel to really get in, down deep enough to treat those fine lines. Something like a phenol peel, which we've seen on social media, that is, you've seen those people that take the face off the skin, the skeleton of the skin off the face. So they're great for pigmentation and just little refreshers. But sometimes you need a laser to remove, for example, a broken capillary, or a deeper line, or maybe a brown spot that a chemical peel will probably help lighten, but may not fully remove.
Okay. How about under eye wrinkles and crepiness? So that's a common complaint as people get older. We know that the collagen gets thinner as we get older. The skin gets thinner even under the eyes. What do you recommend, first of all, cream wise, topical wise, for somebody who's got some thinning of the skin or the eyes, that crepiness? And then what do you recommend for any other type of a treatment to help to reduce that?
Yeah, that is such a common complaint. I mean, even in patients as young as in their, 30s. And like you said, it's one of the reasons is because the eyelid skin's so thin, it just gets so damaged by UV rays. So I always have this discussion with patients before I even recommend an in-office treatment is, one, you really need to be wearing sunscreen there. Using a mineral-based SPF to protect that eyelid skin is really important. So that's just, you should be doing that starting in your 20s. And then peptides are another great treatment for the under eyes because they tend to be gentle. They're not as irritating as some of the other anti-aging ingredients. And the way they work is they sort of trick your skin into thinking it needs to make more collagen. So it gets it to produce more collagen, more elastin. And it also can be very hydrating to the under eye skin. And then retinols really are the gold standard when it comes to any sort of fine lines and wrinkles, including the eyes. But you have to be really, really careful because retinoids are so powerful. And again, the eyelid skin's so delicate, you have to be very cautious about how much you're using. And, you may consider using maybe an eye cream with retinol that's designed for that delicate eyelid skin. But those are my sort of top 3 treatments what you can be doing at home in that area.
And then as far as an in-office treatment to help to reduce the fine lines and wrinkles and the crepiness under the eyes, what do you recommend for your patients?
Yeah, so again, my go-to is always laser resurfacing because essentially what we're doing is removing fractions of skin and then allowing your body to form new skin that's tighter. We can also use like the CO2 laser, for example, that generates a lot of heat, and that heat helps shrink the collagen and tighten that skin. And we see that in real time as it's doing that. So if somebody does have a lot of loose skin, then I either do the CO2 or a full ablative erbium to really take that skin and pull it tight, essentially shrink it in that area. And so that's one of my favorite treatments in around the eyes. Now you can also do things like microneedling for some of the fine lines under the eyes. That doesn't use a lot of heat, so it's purely mechanical, so you don't have the benefit of that heat contraction that we see, for example, with the CO2 laser. But if you've got darker skin, then that might be a good option to start with. And other treatments would be radio frequency or ultrasound skin tightening. It really doesn't do a lot for texture. You'd have to combine the ultrasound or radio frequency with microneedling. So a lot of devices do that. They're RF microneedling is what they're referred to as. And so you get a benefit of the texture improvement with the microneedling, and then the heat from the radio frequency to help with that tightening. And then, people talk about PRP or PRF around the eyes, which is helpful. It'll help boost the quality of the skin. But I don't know how much it really does for texture in terms of fine lines. So I haven't been terribly impressed. Now, I always do combine PRP if we do laser resurfacing or microneedling or RF microneedling. If we do that, then yes, I think PRP is a great addition. But on its own, I'm not sure it's doing a whole lot. You're not going to see super dramatic results.
So your go-to, would it be a fractional for if you had a go-to treatment for under eye wrinkles and crepiness, or would it actually be ablative?
Yeah, fully ablative a lot of times, especially if somebody has a lot of loose skin and I'm trying to get in there and really tighten that skin. I mean, I've done cases on some of these patients and it looks like they had a bleph. The amount of tissue shrinkage we get, and that's just dependent on the patient. Some people, depending on their skin, sometimes the thinner the skin, the more contraction you can get. But it is variable. Not everybody has those results, but you can get pretty significant tissue shrinkage and tightening with that. And fractionated resurfacing is good. Maybe for somebody who's in their 30s and 40s, then it's not going to be as aggressive because you're only removing fractions of skin. You're not removing the entire surface of the skin isn't removed. So it is, less downtime, less invasive than, let's say, a fully ablative.
Hyperpigmentation is a problem that so many people suffer with. Now, can you give us some options of what you do in your office for hyperpigmentation? Not melasma, we'll ask specifically about melasma afterwards, but we're talking now more age spots, sunspots, that type of thing.
I see. Yeah. So we see a lot of that in Southern California because we have a lot of fair skinned patients who are in the wrong climate. They should be in Northern Europe somewhere, and they're here in Southern California. So we see a lot of red blotches, brown spots, and that translates to sort of this discoloration in the skin, this weathering that happens with sun damage. And my favorite treatment is the BBL, which stands for broadband light. Technically, it's not a laser, it's a light device, but it works amazingly well for those brown spots and the red blotches. Just does such a nice job of cleaning up that skin. And there's actually been studies on the BBL that have shown it also works at the cellular level in terms of when they've done biopsies in patients who have had their skin treated with the BBL versus skin that was not treated with the BBL. And when they looked at skin markers, the skin that was treated with the BBL on that patient showed more youthful markers. So not only is it removing that discoloration and sun damage, but it's also doing something at the cellular level to reverse that skin aging. And it's a great treatment, one, because it doesn't have a lot of downtime. There's no open skin. The light actually passes through the skin surface and very selectively removes the brown spot or the red blotch or the broken capillary. So it's pretty cool in that sense that it's very selective, very precise. And what happens is the brown spots come to the surface of the skin and they almost look like little coffee grains, or they look a little sandy like, and then they flake off over a course of 3 to 5 days or so. And patients are really happy. Now, if you've got a lot of sun damage, then you're really looking to do 3 to 5 treatments. You may want to do a series of it.
Mm-hmm. And do you find that doing fractional or non-ablative laser treatments can help with hyperpigmentation, or is that not really going to do a whole lot?
Well, it depends on the type of hyperpigmentation, and it also depends on the skin type. So devices like the BBL, which is similar to IPL, a lot of people have heard of the IPL. If you've got darker skin tones, like somebody like myself, or maybe even darker, then a BBL would probably be a little bit more risky because those light devices, they really depend on the color contrast of the skin, right? So if you've got brown hyperpigmentation, and that patient's skin is also, very similar in shade, then the laser is not going to be able to differentiate the two very well. So in that case, then doing a fractionated resurfacing is a great option. Again, you're looking at several treatments. And in my practice, I also combine it with a topical lightening solution, because when we are doing fractionated resurfacing treatments, the skin is open. And so anything we apply topically is going to be able to get into the skin and be a lot more effective than, let's say, if we were to apply it to, intact or skin that hasn't been treated. So those are some of the other things that we utilize in our office, is some of these medicated solutions that help with lightening pigmentation. But yeah, I think for somebody who's a little bit darker skinned, than doing I love the profractional laser for that, just really light, not super dense resurfacing treatments can be really great. Or even, the Moxi or the Halo, clear and brilliant. These are things we talked about. The non-ablative resurfacing can also be helpful.
Okay. And how about melasma? I mean, melasma is a whole other beast to deal with. There are people who go on social media, say, lasers are not helpful for melasma. They could even potentially worsen the situation. What do you recommend for your patients who come in and they've got issues with melasma?
Yeah, so melasma is so challenging. I call it the diabetes of dermatology because it needs management, 12 months of the year. There is no real cure for it. We can clear melasma, but if you want to maintain that clearance, you're going to have to continue being on treatments. Otherwise, it's so resistant, it comes back so quickly. So I always tell patients, your worst enemy, if you have melasma, which if you don't know what that is when you get dark patches on your nose, your cheeks, the upper lip, which is really distressing for women because it looks like they have a mustache. Some people call it the mask of pregnancy because it is related to hormonal climate. So if you're on birth control pills or have, higher estrogen levels, but really it comes up when you're exposed to sun, so UV rays and even blue light from screens or from visible light that comes through windows, and also heat. That's the other trigger that a lot of people don't realize. So those two things are really your worst enemy when it comes to melasma. And because it is a challenging, treatment, and it is a medical condition, we really need medical therapy, some sort of prescription regimen all year long. And so in my office, what we've done is created a program called Skin Bright. And Skin Bright really does that for you. So you have a visit every 3 months, and we adjust your treatment and your regimen, your prescriptions and whatnot, to how your skin is responding, whether it's summer or winter, because we would treat melasma differently depending on, the climate and the conditions. And so I really think that there needs to be ongoing management for you to maintain that clearance. And it's not just one product. I see a lot of patients that come in and say, I tried hydroquinone and I tried Triluma. It did not work. Well, it's not just that. It's all the other things that are in your regimen. Because melasma, if you get irritation, let's say you're using hydroquinone and Retin-A, if you get any kind of irritation from the treatment, guess what? Your melasma is only going to get worse. So it is not going to work. So you really need somebody with a lot of experience and really a very insightful understanding of the skin and hyperpigmentation to be able to put together a skincare regimen that involves prescriptions to manage your melasma. But for me, melasma really needs medical therapy. We use things like oral tranexamic acid, which was a surprising discovery in dermatology. It works really well. We use topical prescriptions like retinoids, hydroquinone, azelaic acid. tranexamic acid, glycolic acid. But again, those are selected very carefully, and the formulations of those products should also be selected carefully, depending on the patient's skin, what other products they're using in your regimen. So I think there's a whole art and a whole recipe that goes along with successful melasma treatment, and then also maintaining your results. And so it was one of the reasons we created Skin Bright for our patients. But I agree, a lot of times the lasers make it worse, because if you think about it, lasers are what? They're light-based and they generate heat. And those are your two worst enemies, because that is what triggers melasma. So it's no surprise that somebody is going to not get good results from lasers. And can you still do lasers if you have melasma? Absolutely. We do that all the time. But you really have to first be on a prescription regimen, get your skin prepared, make sure that you're doing your medical therapy when you go in for that treatment. And then also the post-care is going to be really important also. And I also wanted to say that even those LED lights that people are doing at home, they can also trigger melasma. I don't think a lot of people realize that. The LED lights, again, they're light-based. You're looking at visible light. Hot sauna, hot yoga. So what I like to do is really get an understanding of what is this patient doing in their life that could be, impeding or holding back the results from clearing their melasma. And then we also do a lot of chemical peels in the office for melasma, I think, because again, they don't generate heat, they're not light-based, so they can also be very effective. Microneedling with a brightening solution is probably one of my favorite treatments for melasma, just because it's mechanical and not light or heat-based. So oftentimes we combine the microneedling with a topical brightening. You're looking at doing, again, 3 to 5 sessions while you're on medical therapy. And I want to emphasize that again, because it's so important.
So it sounds like with melasma, it's almost like, because I think when we think about dermatology, we think about, oh, a dermatologist comes in for 3 minutes, they got to see 50 patients a day and stuff. Whereas melasma, the way you're describing it, almost kind of reminds me of functional medicine, where you have somebody who sits down with you for 45 minutes, goes over all of your environmental exposures, diet, and really, in order to effectively treat melasma, you really have to take that type of an approach, where you have a dermatologist who's going to go over this information and not write you a prescription, be in and out in 3 minutes.
Absolutely. And that is one of the reasons we created Skin Bright for our patients, is because I realized after 17 years of practice, this is what it takes to keep melasma away, to get rid of it, to treat it, because it's like diabetes. It's not going to go away. Your blood sugar is going to spike. If you don't provide that education for the patient, if you're not really looking into their lifestyle and seeing what is coming into contact with their skin, you're not really going to help them. You're not going to clear their melasma, and melasma is not going to stay clear. It's just going to be a waste of money. Here they are. They went and did a laser. They went and bought this really expensive cream. And guess what? They still have melasma. And it's frustrating for the patient, obviously the provider who's helping that patient. So with Skin Bright, we control anything that goes on your skin. So you get a set of products. And so I know exactly what's going on your skin. They're not, going to Sephora and buying this and that. And their esthetician isn't telling them to use this. It's great for melasma. They're really getting this customized, comprehensive approach to a very challenging condition. And I think that's really the only way to manage melasma. I look at it very similar to diabetes, where it takes a lot of education and lifestyle changes.
So we covered crepiness and wrinkles under the eyes, and you did mention earlier about a treatment that you have called eye glow. So another issue that people a lot of times have is hollowness under the eyes, under eye hollowing. So how do you treat that in your practice?
Yeah, so hollowness is, where you have an indentation or a depression in the skin, and it causes a shadowing effect. And that shadowing effect comes across as dark circles. It can also make the eyes look more aged, more tired. It can make the eye bags, for example, more accentuated. And so if you have true hollowness, then eye glow is a filler blend that is white, and it's used to lift that hollowness in that under eye area. But also, it's not just a filler to add volume. It actually also helps add support and structure to some of the ligaments in that area. And because it has calcium hydroxyapatite as one of the ingredients in this filler, it also has a cell mediated effect where it signals your skin's fibroblasts to produce collagen and elastin. So it also has a, biostimulator in terms of, long lasting effects in terms of skin tightening and so forth. So it's used to kind of lift and brighten the under eyes because it's white. And you can't see through it. You don't have the risk of getting that Tyndall effect, which is where people get that blue-gray hue from fillers. And it's placed actually quite deep, so it lifts everything from the deeper structures up. And it's not just tear trough filler. A lot of people think it's tear trough filler, but it's actually that entire under eye area that we see start to get loose and migrate down or have hollowness just genetically. And it lasts for actually a number of years. I would say 3 to 5 years at least. So it doesn't go away very quickly. So I've been really happy with it. My patients have been really happy with it. I'm very selective on who I treat. And I think that really should be the key when you're doing fillers or under eye, treatments, is this the right candidate for this treatment? Because a lot of people come in and they think they have hollowness, but they don't. They have normal, contours that are supposed to be there. And so I think it's really important to be selective in who does this treatment if you want to have good results and good outcomes.
If you have some, I mean, there's some doctors now who are talking about PRF acting as a filler under the eyes. I was at a meeting several months ago, and a lot of people were talking, a lot of dermatologists saying, oh, now I'm using PRF under the eyes. And they say that it actually acts as a filler. Now, I've been around long enough that when PRP was starting to be used cosmetically as an injection, I remember when people were claiming that that had a filling effect as well. And I never saw any type of filling effect from it. What are your thoughts on PRF as an actual under eye filler?
I agree with you. I'm not impressed. It is, to me, it's not a filler. I had a lady the other day that came in and she had significant hollowness under eyes. And she came in and she was like, I want to do PRF. I don't want to do filler. Now we have this filler fear going on. But I want to do PRF. And I said, you're going to waste your money. You're not going to get volume out of that. I've been really underwhelmed by the amount of volumization that it provides. It's not a volumizer, in my opinion. It has growth factors. Yes, it improves the quality of the skin. The other issue with it is a lot of times it's injected, right? And that eyelid skin is very thin. And then people end up with horrible bruising under the eyes. And then they have hemosiderin deposits. And then that leads to pigmentation under the eyes. And then that leads to discoloration. And then now they've got, not only is their hollowness not better, but now they've got discoloration to deal with. So I think that, I don't think that it really does much for hollowness.
It doesn't make sense to me. I mean, I get that injecting PRP and PRF can rejuvenate maybe skin quality because you're getting a high concentration of growth factors in an area. But to me, it doesn't make sense that it's a filler because essentially you're injecting your blood into an area.
Exactly.
I mean, yes, you
No,
spin
it's
it
not a
out and stuff like
volumizer.
that, but it's still your blood. Like it's still and your
You're
blood is
just
not a
injecting
filler
growth
because
factors, which is great. I
yeah,
mean, that's not bad. I think
it's
sometimes
just
these things
part of your
are,
blood. Yeah.
that's right. I think they're great in theory, but when it comes to practical results and real results, they just don't translate. And this is one of those cases where, you can have all these publications and all these theories about how it helps with under eyes, but it's not going to help with hollowness.
So we have just a few minutes and left, and what I'd love to do is do kind of a quick hits here. I'm going to give you a skin condition, and if you can tell me what your device, the specific device that would be your ideal treatment, just so that we don't worry about different skin colors. Let's just say that this is somebody, a patient comes in and they're Caucasian, so we're not talking about darker skin where that, a lot of light-based devices are more risky. But I'd love to ask what you would recommend as your ideal treatment for a Caucasian patient coming in with this problem. And we'll kind of move through these pretty quickly. The first one is skin laxity, looseness, early jowling, a little bit of looseness of the skin of the neck. What would be your ideal treatment for them?
So I would do Exelis or radio frequency device or soft wave ultrasound or radio frequency skin tightening.
Okay. And those are both very, very popular nowadays. Acne scarring, so severe acne scarring.
So laser resurfacing, like a fully ablative erbium or a CO2 laser.
Fractional lasers, will they not quite get you where you want to be if you've
I would
got
do a
significant?
combination of fractionated with fully ablative. I usually combine those two together for acne scars. Yeah.
Spider veins. I know you do sclerotherapy. You also use lasers for it. What would be your ideal treatment for spider veins?
Sclerotherapy, that's the gold standard. Lasers actually hurt and they don't treat the entire vein like the sclerotherapy does. Yes, we also combine them with lasers, but really the gold standard is sclerotherapy.
How about somebody who has a post-surgical scar and the scar is getting hypertrophic, a little bit thick? What would be your protocol for treating them? Obviously, you could put topicals like topical silicone, but what other type of treatments would you recommend?
So I would do a V-beam laser, the pulse dye laser, and injectables like Kenalog, 5-FU. Those are medications that break up thick scars.
Mm-hmm. Do you find that IPL treatments can help with scars much?
Yes, yeah, because they help the vascular component. But still, I think the V-beam or pulse dye laser works a little bit better.
How about stretch marks? First question on stretch marks. Are there any creams that can help with stretch marks?
I mean, retinoids, you can do that. They can help remodel. Stretch marks are similar to scars. You could do silicone gel. And then in terms of office treatments, if it's early stage stretch marks, so if they're red or even purple, then you can do the pulse dye laser, the V-beam laser. And then for lighter or more established stretch marks, you can do microneedling, you can do fractionated resurfacing, like the profractional laser would be my go-to.
Now, as a dermatologist who's totally on the cutting edge of cosmetic treatments, are there any treatments on the horizon that maybe we don't have here yet that you're really excited about getting here and helping treat your patients with?
Yeah, so I mean, you hear a lot about these polynucleotides, and people are going over and doing those, and I don't think we're quite there yet, but they're showing some promise, some interesting longevity sort of treatments. I think that there is going to be more devices and lasers where the duration of the pulse is going to be manipulated in such a way that we can get results like the fully ablative resurfacing lasers, but in a shorter period of time with less downtime, less risk, and less just less recovery. So I think the devices are just getting better and better, and some of that laser technology is exciting to see. And then I think some things on the horizon in terms of injectables for targeted, fat reduction is exciting too. People are always looking for that. Whether you could apply that to the the under-eye bags or love handles or some of those very stubborn areas of fat that now the best treatment I think is like more invasive, like lipo.
Well, I really want to thank you for joining me today. Dr. Ozzy, you can find her. She's very active on social media. You've got to check out her podcast. Her podcast is called More Than a Pretty Face, where she covers all the different aspects of dermatology, both cosmetic as well as medical stuff. She has guests. I was lucky enough to be a guest on your podcast before. So
Yes,
definitely
we'd
want to
love
check
to
out her
have you. You have to
podcast.
come back on. We have to have you on
Thank you.
again.
Yeah, would love to. So our podcast, once again, is More Than a Pretty Face. We're going to have all the links to her website and everything here on the podcast caption. She also has her own skincare line, Dr. Ozzy, MD. OzzyMDSkincare.com, and then check her out in La Jolla. That's where her main office is. Thank you so much for joining me today, Dr.
Thank you so
Ozzy.
much for having me. This was so fun. Thank you.
Yeah, I appreciate it. Well, thank you so much, everybody, for watching and listening. I'm Dr. Anthony Youn. This is the Dr. Youn Show. If you've been enjoying this podcast, if you could leave a rating or review on iTunes or Spotify, wherever you get your podcasts, every week we'll give a quick shout out to somebody who does. And as always, remember to eat real food, use clean skincare, and auto-juvenate before you operate.